Hi everybody, thanks for joining in the video conversation this week. I really had enjoyed the opportunity meeting with a lot of Minnesotans that were in town in DC, talking about issues such as finding cures for rare diseases, prostate cancer screening, as well as veteran service issues. I really enjoy hearing the passion of Minnesotans and others that take the time to talk about why these issues are important and they should be on the forefront of finding some solutions and being on our agenda. We're going to get to our questions now though, and actually the first comes up in an email from Dennis in Plymouth, who writes in, Representative Paulson, I'm a member of the Coalition for Medicare Choices, and I'm asking for your support of the Medicare Advantage program. More than 18 million Americans like me depend on Medicare Advantage for their care. As Congress and the new presidential administration consider ways to improve and sustain Medicare, I ask you to strengthen this vital and proven part of the program that has led the way for many years on value-based care. Please do all you can to make sure the Medicare Advantage program is not eroded further. Sincerely, Dennis. Dennis, actually, thanks for sharing your thoughts on that. As you point out, there are about 18 million seniors across the country who use Medicare Advantage. Actually, it's about 50%, 30% of all Medicare enrollees. In Minnesota alone, we have 175,000 participants in Medicare Advantage, including over 55,000 in the 3rd District alone in our area that seniors use. It is a great program, and unfortunately, in past years, recently, it has been targeted for cuts, which has reduced the sustainability and the integrity of the program. It's why I led authoring a letter to the Center for Medicare and Medicaid Services with a bipartisan group of my colleagues, 260 members, saying that we should maintain this program's strength and integrity, making sure the funding is going to be there for our seniors with the flexibility, and we hope that with enrollment growing over the next few years, that message will be heard loud and clear. We'll be able to sustain the program for seniors in the future. Next up is a Facebook comment I actually received from Linda in Eden Prairie, and Linda comments, Representative Paulson, thank you for mentioning Rare Disease Day. My son has Marfan's syndrome, and that has led to many serious, life-threatening, and expensive conditions and surgeries. Please consider these people when you are voting on or crafting your plans for health care. Linda, thanks for sharing those comments. As I mentioned earlier, we celebrated or make sure we recognize this week Rare Disease Day. There are over 6,000 different rare diseases across the world that have no known cure or essentially treatment. And a lot of these, unfortunately, these rare diseases impact children, young children. But because there are usually small populations that have these types of diseases, they don't often get the attention, the care that they need in terms of focusing resources on finding cures and finding treatments. What we can do is making sure that we're continuing to target innovation. Even the President outlined this as a necessity as a part of his speech to Congress and to the United States this week, that we should prioritize medical innovation. We should streamline the FDA, making sure that new drugs, new treatments, and new cures are coming on the horizon quicker and faster. I'll continue to be a champion on those issues, making sure we're looking for every available opportunity for that entrepreneurial spirit that will help many patients. I want to thank everyone for taking the opportunity to join in this week. Continue to reach out anytime on Facebook, on Twitter, on Instagram, or of course on the website at paulson.house.gov. Have a great weekend and a great week.